In the old way of working, we sort of followed a care plan, which stipulated the amount of hours a person had and what type of support they needed. A lot of the people we support, they don't need help with cleaning their house, certainly not for 3 hours on a Monday morning.
They've been in the system for about 10, 12 years, some of them, so we're used to the delivery that we were giving them, which was very, very much controlled by us as staff rotas and their care plans. I was invited to attend a Supporting People team meeting to try and learn a little bit more about the lean systems thinking and try and introduce that into the way we delivered our support.
We had to cut costs, we had to support more people with less money. When we introduced the new systems thinking, we brought in a small number of service users and a small number of staff. People were fully aware that we were working to demand and it would be an improvement on the service.
I think they were a bit fearful of it because they thought that perhaps people would get missed or the people wouldn't get the support that they needed.
There was a lot of reassuring that we had to do, that it wasn't a case of cutting and not being there to provide support for them. It was to encourage them or to let them grow and be able to do things for themselves.
I have noticed things different in the way I get support now than how it used to be, because instead of me making a time slot available for specific times in the day or specific days in the week, I'm phoning up and I'm arranging my time for people to come and just do something.
A service user can make a demand. It could be face-to-face when they're with a support worker. They could make it via telephone, phone the office, emails or texts. If it's face-to-face and we're there, we try to follow that demand through straight away, like, can you help me with my shopping? Can you help me make a health appointment? We can do that there and then. Every person we support has a number for confidentiality reasons.
The demand is taken in the service user's own words. That is really, really important. So then we can identify what it is that the service user is really, really asking for. Because on occasions it might be something that you think it's I need or I want. However, there could be some emotional need in that demand.
There are times when a service user will make a demand which we are unable to see through for whatever reason. It may be an appointment for a future date, and those demands are then logged onto the system so that we've got that information in place. When we call up the demands for the day, we can identify who has got appointments, etc.
So we take all of the details, the time, which is important, because when we do sort of studies and we try and see if there is a pattern to any of these demands, that can be identified. And we can also see, by recording all of the information, we can record to see how people are progressing and how they are becoming more independent, and how these skills that they once needed us for, they're now doing on their own.
We all need support sometimes, and what we do is help people with whatever need. If we're the right people to do that, then we will help them with their demands.
If we're not the right person to make the demand, that we have to ensure that we know who is the right person and we can pass that on.
When we started this, we realised that some people wouldn't phone the office when they needed support. What we do is we phone people and ask them if there's anything that they need, if they're okay, and we keep in touch with people on a regular basis.
We have actually put in predicts into the system whereby we actually put information on where we know a service user is needing support, even if they haven't actually asked for it.
We do record on our Lime server OK seen, which means that maybe I've been in town on Saturday shopping and I've seen somebody that we haven't seen for a good while. So that's entered onto the system, so we've got a record.
Now people meet up more together. They seem to look after each other more.
We also hear from other service users that someone is having problems, and then we will make a phone call. I think they are more supportive of one another, and I think that they actually will come to us and tell us if they have any concerns about their fellow service users now, whereas before maybe they wouldn't. They may have thought they were interfering, but because we have now encouraged this way where everyone is free to come to us and tell us things, I think they are working closer. There are friendships that have been formed, and I think they are supporting one another to live more independently. In the past also they have been actually waiting around for support. They know they're having support, they might have other plans, but they're actually putting those plans on hold because their support is coming that day, and that doesn't happen anymore. So I think they're able to have more say in the way they live their life.
I phone up Cartrefi office, they'll help me out if I'm stuck. I like support when they come up. They phone up and let me know when they come up, help me with the bills.
When we're supporting people now, we actually feel as though we're doing what they want, and we're not actually there because we're supposed to be there. We're not there because it's part of the rota for the day. The service user is actually wanting our support to do a specific task, and I think there's a lot more job satisfaction as a support worker to do that.
I do believe that what we've done over the last 2 years is provided them with the confidence to go out and do these things themselves.
I feel a lot more independent in the fact that I can go out and do whatever I want, and whenever I need some support, I'll just phone up and make some time to arrange it, instead of having separate joint things in a week where I have to be in for this support or I have to be in for that support.
I feel that we are working together far more effectively as a team than we ever did before, and I feel that the service users are getting the right support.
They are helping people to reach their goals and helping people to reach their aspirations because they are supported in a completely different way. We are supporting more people with less hours because of this system. So we've just got to keep learning from our data and make sure that we work as wise as we can.
We have reduced our level of support hours that we've been providing simply because service users have improved and they've developed and they've been able to reduce the hours that they get. Supporting people would like us or trust us enough to use any spare hours that we have to go out there and identify what it is that we can be doing to help people. We have some free time for learning, which is really important, and also to go out there and maybe do some collaborative working, because again I think that is another way of saving as a whole, so that we can go out. So if we are supporting somebody with learning disabilities out in Talgath and they have a neighbour who has a problem with drug and alcohol, rather than somebody from Ystrad come and support that guy with the tenancy related issues, we can do that. They really feel that it's been quite a good and is a good system because it also allows us to take on more people. Their care plans are written up in a different way.
They don't stipulate hours in a care plan of what a person needs. They will just leave it open and we support people as and when they need it. We help them with the demand that they have, what they need. And I think now it makes them more independent. They have a feeling of more independence, but knowing that they have someone when they need help.
What I really appreciate about this is the fact that you're willing to work on my terms.
This new way of working has gone down quite well with service users, care managers and families, and I think that's down to their involvement from the very beginning.
I don't phone very often to the office because I don't have time, because I like to go out a lot and meet people and visiting people. I go downtown, I go down on the dial ride on a Wednesday, meet people there and we have a cup of tea and play games, loads of things. We enjoy it. I've got friends there now.
If that service user is happy, content, is confident, has the ability to be able to ring us should there be a need, and not to ring, and to be living quite happily without even contacting us, then that's what supporting people is about really, is just being there when there is a need.